is Amanda. I'm going to be your nurse today.
Hi, I'm Anaisa. I'm going to be assisting her.
Hi, Amanda. Hi, Anaisa.
Okay. Can I please have your name and your date of birth, please?
Narita Ketchatriakul, January 25th, 1990.
Perfect. Thank you. Before we continue, is it okay for your visitor to be here while we talk?
Yeah, that's okay. That's my sister, Nicole.
Hi, Nicole.
Hi.
Please let me know if you have any questions or concerns while we discuss your sister's treatment. But first, I'd like to ask Ms. K a few questions before we begin. Afterwards, we can go over any questions or concerns you both have, okay? Can you please tell me what today's date is?
November 2nd, 2018.
Perfect. Do you know where you are right now?
Yep, I'm at the hospital right now. I'm on the oncology unit right now, to be exact.
Do you use any corrective lenses or hearing aids?
No, I don't.
Okay, thank you. Can you verify any medications or supplements you're taking right now?
I don't take any medication right now. Sometimes I take a multivitamin if I remember in the morning.
Thank you, Ms. K. Do you or your sister have any questions for us before we begin discussing your drug therapy?
Well, actually, I have a lot of questions. This chemotherapy thing is quite confusing. Can you tell us why my sister will be starting this drug?
Great question, Nicole. So, Ms. K, you have been diagnosed with non-Hodgkin's lymphoma, which is categorized by rampant proliferation of your body's lymphocytes. The main treatment for patients diagnosed with non-Hodgkin's is chemotherapy. Chemotherapy is highly individualized to each patient, so the drug of choice or treatment regimen depends on the type and the stage of the disease. For your specific case, the recommended drug therapy chosen was BLEOMYCIN, which is a chemotherapy agent commonly used to treat non-Hodgkin's lymphoma. Chemotherapy is typically given in cycles so that the body has time to rest and recover in between treatments.
BLEOMYCIN? That sounds scary. How does it work?
BLEOMYCIN has the ability to target and kill cells that grow and divide rapidly, particularly malignant cells, by inhibiting the DNA and RNA synthesis. Unlike other drugs in the same category as BLEOMYCIN, it does not injure the heart and causes less bone marrow suppression than seen in other chemo agents.
It kills my cells? Isn't that a bad thing? Am I going to experience many side effects from this drug?
Unfortunately, this drug may affect some healthy growing cells as well, which can attribute to some undesirable side effects. You may experience some chills, fever, weakness, maybe some disorientation or confusion, low blood pressure. You can experience some aggression, nausea and vomiting, some weight loss, hair loss, and skin reactions, like rashes and hyperpigmentation. Since BLEOMYCIN achieves high concentrations in the skin and lungs particularly, it is important that we monitor your lung function and assess skin reactions very closely.
Is it 100% likely that I'll develop these side effects, or does it vary from person to person? Am I going to be nauseous all the time like the cancer patients in movies?
While the amount and or severity of side effects varies greatly from person to person, I can tell you that the nausea and vomiting are relatively mild with BLEOMYCIN compared to other chemo agents. If you feel that you're experiencing severe or prolonged nausea and vomiting, I would like you to notify your nurse or healthcare provider. There are drugs that can be given concurrently to help alleviate any nausea and vomiting if needed, so please don't be afraid to speak up.
Is there any side effects that we should be especially careful that we look out for?
Yes, since pulmonary toxicity may occur while taking this drug, please make sure both the patient and or family members involved in the patient's care watch out for any respiratory symptoms. In other words, please notify us right away if you feel short of breath or if your breathing has changed at all. Respiratory distress can manifest itself in different ways, so please be sure you're looking out for any indication in a change of breathing pattern and let us know right away so we can assess further. You've received a chest x-ray already so that we have a baseline to compare throughout drug therapy.
So as mentioned before, you may experience fever, chills, wheezing, and low blood pressure. Although these side effects may not seem that serious, they will still need to be reported to a healthcare provider right away, as this type reaction is potentially life-threatening and needs to be further evaluated. Patients on BLEOMYCIN are typically pre-medicated to decrease these side effects. However, it's important you notify us so we can determine whether or not we need to intervene or even resuscitate you if this reaction is that severe. Most importantly, these side effects may occur several hours later, so please be sure to continue to monitor for this type of reaction even when you're back at home.
Okay.
Is there anything you'd like us to clarify? Can you please explain back to us what you're going to be looking out for?
I'm going to report right away if I'm feeling any difference in the way I breathe, if I'm short of breath, have difficulty breathing, pain when I breathe, and so on. I'm also going to report if I'm feeling feverish, have the chills, wheezing, and how would I feel if my blood pressure is low?
You may feel a little dizzy or just out of it, confused, weak, dizzy upon standing. Those can all be indications that you have low blood pressure.
Oh, and we should continue to monitor for these symptoms even at home, right?
Yes, exactly. Do you have any other questions about what signs and symptoms to look out for?
No, thank you.
Well, Ms. K, I familiarized myself with information regarding your cultural background, and I want to ensure that your needs are being met. Do you have any questions or concerns regarding your cultural preference before we begin your drug regimen?
Actually, yes, I do. I feel really nervous about how much hair I'll lose. In my culture, hair represents spiritual strength, and honestly, we all love our hair regardless of its spiritual meaning. I know it's just hair, but short thinning hair is something that I'll feel really ashamed of. I've been growing my hair since a very young age. I really value it very much.
I understand that your hair plays an important role in your culture and how you are viewed by others. Side effects from drug therapy vary from patient to patient, so I cannot say whether or not you will experience hair loss or how much at this time. However, I can assure you that establishing a strong support system is going to be key while undergoing treatment. I really encourage patients to identify who their support systems are made up of prior to beginning treatment. Aside from family and friends, there's also several local support groups that you may benefit from joining. Sometimes when we go through difficult times, it's easy for us to feel like we are alone or that no one understands what we're going through. Support groups may help you feel connected to others going through similar situations, and they could serve as a place to learn new information, share coping strategies, and just speak openly without judgment. I could provide you with a list of some support groups in your area if you wish.
Also, us nurses have learned a thing or two from other patients since working on this unit and can provide you with some shampoos and other hair products, including some herbal remedies that have helped other patients reduce the signs of hair thinning and hair loss. I hope this information helps alleviate some of your concerns.
Wow, I had no idea so many support groups existed. I'm so lucky to have such a supportive family, but I guess I'm more concerned about how I'll be viewed by my community.
I'm happy to hear that your family is involved and supportive. Losing hair may be very difficult, and coping mechanisms may feel out of reach. I highly recommend taking a look at the list of support groups we will be providing you with. It will allow you to hear from others who are going through similar experiences, especially others who share similar cultural beliefs as you. Right now, I suggest taking drug therapy day by day. If you feel you are experiencing symptoms of hair loss that are negatively impacting your psychosocial well-being, you can explore synthetic hair options as well. Your health is our priority at this time. However, as nurses, we understand that the patient's health and recovery is also strongly impacted by family, environment, culture, and even self-image.
Thank you. I really appreciate you taking the time to familiarize yourself with my culture. I now feel confident knowing I have some options if I'm to experience significant hair loss from this drug therapy. Both of you have done a great job at answering all my questions. What's the next step?
Before we begin your treatment, I need to make sure you have read and signed a consent form to receive chemotherapy. Your oncologist will join us momentarily to review the consent form with you. After the consent form is signed, one copy will be placed in your chart and a second copy will be given to you for your own records. Do you have any allergies, Ms. K? Allergies may include drug allergies, food allergies, environmental allergies, or even allergies to latex.
No, I don't have any allergies that I'm aware of right now.
Okay, great. So, Ms. K, patients diagnosed with non-Hodgkin's lymphoma must receive an initial test dose before beginning their IV fusion. I will only be administering 1 unit of BLEOMYCIN via subcutaneous injection. Once we confirm that you had no acute reaction to the drug, we will switch to administering BLEOMYCIN by IV infusion as planned. In addition to a chest x-ray, we also ordered a complete blood count prior to administering this drug, so we have a baseline to compare to throughout your drug therapy. Next, I'll take your vitals to make sure everything is stable before we begin. Okay, your vital signs are stable. I will be periodically monitoring your vital signs throughout drug therapy as well. Our second nurse, Anna, has already double-checked the original order and made sure my dose calculations were correct. I will be right back with your initial test dose, Ms. K. how are you?
I'm good. How are you?
Hi, Ms. K. I'm happy to inform you that you tolerated the test dose well and no adverse reactions were observed. So we will continue with our plan to begin infusion. Can you please tell me your first name and your date of birth again?
Narita Ketchateriaku, January 25th, 1990.
Okay. It matches what the medication order says on the medication. And it matches the medication order in the computer. Thank you. Our second nurse, Anna, will now double check your name and date of birth as well.
Can you tell me your name and date of birth again?
Narita Ketchateriaku, January 25th, 1990.
And check you. Great. We have completed all necessary checks to ensure all rights of medication are correct. This is the right drug given at the right dose, through the right route, to the right patient at the right time for the right reason. The patient has already been pre-medicated with acetaminophen to reduce symptoms of fever and other idiosyncratic responses to BLEOMYCIN. I'm now going to hang this sign above your bed. I'm now laying the bag on a chemo chuck to protect the surfaces. And I will take out the BLEOMYCIN and inspect the bag for particulate matter, discoloration, and make sure that the drug is not expired. I will now be placing the patient's ID label on the medication with the date and time of the medications given. And make sure that this is clamped tightly. We will now remove our outer gloves first and place them in the sealable chemo plastic bag. And then we will remove our mask without touching our face and place that in the sealable chemo bag. And then we will roll our gowns inside out. This will be rolled inside out and placed also in the chemo sealable plastic bag. And now we will close this bag and throw this in our chemo wastebasket. We will carefully take off our inner gloves without touching our skin and also toss that in our chemo wastebasket. And now Nurse Amanda and Anna will wash our hands with soap and water. The bed down to the lowest possible position and put the bed rail back up. And I will make sure the patient has her call bell nearby and her bedside table is also within reach. Are you comfortable, Ms. K?
Yes.
Do you need anything before we leave?
No, I'm okay.
Okay, so we will be back to assess your vital signs and make sure that you're feeling okay, and we will also be listening to your lung sounds. Is that okay with you?
Yes.
Now I will document how the patient responded to the medication. And view
Before we begin. Afterward,
cut. There's 15 units of BLEOMYCIN and a 5 milliliter. The bag for particular. How do you say that word? And now I'm going to document how the patient will respond to the med.
hi, how are you? I'm going to be your nurse today.
No, I'm gonna stop already.
are you?